Hello everyone, I'm Dr. Francisco, specialist nephrologist and transplant immunologist working at Francisco Kidney Medical Center in Singapore. Welcome to the Diabetes Health and Prevention video series. Today is part 6, Diabetes Complications. So I hope you enjoy it. These talks are part of our efforts on health promotion, focusing on diabetes prevention and early detection, so you can become a healthier version of your previous self. We have these two health enhancement and weight management programs, Aries, for the Greek god of war, so you can start your battle against sugar and lose weight, and Janus, for the Greek god of new beginnings, new choices, so you can start a healthier lifestyle and also lose weight. If interested, call this number. Let's start the talk proper, that is diabetes complications. It's a very important topic because indeed everyone wants to avoid these sort of complications. People with diabetes can develop heart problems due to poor circulation to the heart or blockage, causing a heart attack. Occasionally, heart attacks can take a life. Also, they can develop chronic kidney disease and kidney failure with need for dialysis or a kidney transplant. Kidney failure by itself shortens the lifespan of patients and create new problems. Patients can have also vision problems and even blindness, leading to disability. Patients can have altered nerve sensation with numbness or pain in hands, feet. They don't realize of injuries, for example, splinters. The splinter can be left there, become an infection. Because of poor circulation, the wound healing is impaired, and patients might need to have amputations, adding to disabilities. Patients can develop strokes for poor circulation to the brain, adding to disabilities as well. The blood pressure can go high, constantly damaging all the bodily organs and precipitating potentially a heart attack, stroke. The same for cholesterol. People can have poor circulation, for example, to the penis and causing sexual dysfunction. Can have digestive problems, poor digestion, vomiting, diarrhea, constipation, or mood issues because some changes in hormones, poor circulation to the brain, or for being overwhelmed with the disease and its complications. All these complications affect the patient tremendously. Personally, in his mind, in his health, but also in the family. Also, their social life or at work, unable to perform a full-time work because tiredness or needing to go for dialysis, etc. But not only the patient gets affected, the whole community gets affected because there is a new individual that is ill and is suffering and is unable to be part of the workforce, but also the disease is very expensive for the patient and expensive for the health care, needing all those cares and cares of those disabilities. So it is in the best interest of the patient, their families, the community, their governments to put all their efforts into fight diabetes and other metabolic chronic diseases. So why these complications happen? Obviously because of the damage that we mentioned before caused by high sugar and other metabolic disorders, but because the disease is too prolonged, allowing cumulative damage, especially this poor glycemic control or presence of other diseases like heart problems, cholesterol, etc. Because the blood pressure control or the control of all those little problems like metabolic syndrome, overweight, etc. not well controlled and favors the development of these complications because poor attachment to diet and therapy by the patient. Therefore, we devised this program called Janus. for the Greek god of new beginnings and new choices. So the patients have the new choice to adopt a new lifestyle, a healthier lifestyle. If they are overweight or obese, to prevent prediabetes. If they have prediabetes, to prevent diabetes. If they have diabetes, to prevent complications of diabetes. Never is too late to start a change, a positive change. Because there will be two choices. One of unhealthy lifestyle and one a healthier lifestyle with better diet, exercise, and better care plan. Because these two choices will lead to two different outcomes. Whatever you do today will make a future possible. If you choose a healthier lifestyle, you are more likely to enjoy a happier, fuller life in which you can fulfill all your dreams together with your loved ones and friends. If you carry on with an unhealthy lifestyle, you are more prone to develop these complications. You will need to change your mindset, adopt new behaviors, so you can obtain these new results. Because you know if you don't implement any change, you're more prone to suffer these complications. I trust you can do it. But if you think you need help, that's why we are here. That's why we develop these programs. To make it simpler, more effective, and more sustainable for you. If you're interested, call this number. Please subscribe to our YouTube channel to hear more details about Aries and Janus. Share our videos because some people can be benefited for hearing this information to understand better the disease or to be aware of what can happen if they continue with a certain lifestyle. Maybe you have no problem, but maybe a friend or a relative, or maybe you're a doctor and this information is very simple for you, but maybe you can tell your patients that they can hear in a little bit of detail all this information, especially if you don't have too much time to explain all this. Please stay tuned for the next talk that will be diabetes diagnosis. Thank you very much.